Good Monday morning. It is December 6th. Welcome into the Morning Medical Update. Thank you for joining us here on Facebook and on YouTube. No doubt this is the time of year we tend to put on those extra pounds. The stress of the holidays, then you add in a pandemic and that new variant. So bring on the bad eating habits. So today we are moving, and even some movement and exercise can keep you somewhat ahead of the game. Plus, it's not just about your weight and physical health. We find out how our mental health is affected this time of year, and also some tips on both ends to keep us mentally and physically fit. So make sure to get in your questions. You can send those in via YouTube, Facebook, and you can email them right there to the Medical News Network. There are some links right there on your screen. But first, Doc Hawk is back with us on this Monday. Back from Florida. He's got the latest numbers coming out of the weekend. Good morning to you.
Yeah, hi.
They're high. They're high, right?
Yeah, not so good for the health system and the inpatient infections. We have 35 active infections, with 12 in the ICU and half of those 6 on the ventilator. 5 of those 35 active infections are fully vaccinated. We still have 22 additional patients meeting that recovery period, so a total of 57. But overall, yes, our active number of infections has gone up.
How was your trip, by the way? Judy already asking how your son did in his soccer tournament.
Yeah, they
good
won.
News?
They won.
Oh, good.
They did well. They won all 3 matches. So.
All right. Well, you're back, and it's cold.
It is cold now.
All right. Do we have any reporters on the line? I don't think we do, but just double checking. None. Okay, so we're going to get to your community questions here in just a few moments. But COVID continues to take a toll on our physical and our mental health. But baby steps, they can help. You can start small, and we have some experts to help us understand how moving, even just around your house a little bit, can make us feel better physically and mentally. So joining me here in studio is Dr. Danielle Johnson. She's a psychologist here at the health system. She mainly works with adolescents and youth out at our Marillac campus. Good morning to you, by the way.
Good morning.
Hey, it's Monday.
It's Monday. We're here.
We're here. We're going to do this. Okay, so we're going to talk about best ways to motivate yourself, motivate your family. But first, we're going to go out live to our Sports Medicine and Performance Center in Overland Park, and that is where we find Alexis Del Cid. Alexis, good morning to you. Tell us a little bit about what's going on out there. Tell us about the Sports Medicine and Performance Center for those folks who may not know.
Let me tell you first, Jess, I have been pumping some iron, and I don't know about you, but I'm here with Roger Allen. Roger, what you got? He's pumping the 50s. I'm pumping the 5s. I'm here with Roger Allen III. Clearly, you don't need to be a pro to be out here because they let me in. But speaking of pros, Roger is. Roger, you have been a sports medicine fitness trainer at several universities, KU. You're here at the Sports Medicine Performance Center. You also played in the NFL for, Rams, Saints, Buccaneers, and Panthers. But before that, he was a local guy just growing up in Kansas City, went to school in Raytown. How long have you been back home?
I've been back home for about 6 or 7 years. Going up is going to be my anniversaries in January.
It's so good to have you back, and it's so cool when we see people go do great things and then come home and do great things in the community. Let's talk about the Sports Medicine and Performance Center because this place is so cool. We have Kelsey Enget right behind us. Apparently, this is a woman who can live on the elliptical and does. That's where she is when she's not sleeping or eating. Roger, tell us about the center and who all can come in here and benefit from the programs here.
As long as you have a heartbeat and you can move your body, you can come into this facility. And even with that, we have physical therapy going on so that even if that's a challenge for you, you still have a place to be. But for the most part, even though it's sports in the name, everybody's welcome. We have lifestyle fitness professionals with Kelsey and our different staff that will be able to meet everybody wherever they're at, whatever fitness level they're at, and help them get better.
Speaking of getting better, we've been talking and we're going to be discussing at length during this program the benefits of mental health from exercise as well. Can you explain the science behind what happens in your brain when you start exercising that can make you feel better emotionally as well as physically?
Well, our bodies are amazingly made, and whenever we're getting ready for high-intense exercises or activities in general, we're going to start to flow adrenaline to help us prepare for that. Well, after that workout, our body wants to shut that adrenaline down. So it starts to release endorphins onto your brain that gives you a calm, relaxed feeling that's going to help you sleep better, give you better mental focus, and just a better overall mindset.
Do you have to sweat and be out of breath and have a super intense workout to actually get those benefits in your brain and get those endorphins released?
Absolutely not. You don't necessarily have to sweat. Every body is different. So if you or a high sweater, you'll sweat. But more than anything, as long as your heart rate starts to get up, you start to breathe a little bit heavier, but still should be able to have complete control of your breathing, you'll be able to release those endorphins once that workout's over.
We see Kelsey's making it look very simple and easy. She's probably not breaking a sweat at all on the elliptical because that's her resting state of being on the elliptical.
Exactly.
But when we come back in a little bit, we're going to have Kelsey Engett, and we're also going to have Roger show us things we can do today, right now. You're sitting at home, you got your laptop fired up, maybe you're sitting in front of your computer. A lot of people have the blues and the blahs, having slogged through almost 2 years now of a pandemic. So we're going to show you the things that you can do today, this hour, from home to get moving again and get those endorphins going in your brain to get that good feeling going and get back into shape. That's going to be a lot of fun. I'm
Sounds
looking
like a
forward to
plan.
what you and Kelsey are going to show us. I'm not going to be pumping 50s by the end of this, but hopefully I'm going to get moving again, Jess.
Okay,
Back
better
to
than
you.
better you than me this morning. I don't get moving quite that early, so. All right, I'll see you in a few, okay?
Okay.
All right, so we got Dr. Danielle Johnson here with us, and since we kind of have exercise on the brain, how do we, good morning, by the way, and happy Monday. How do we get our families motivated to do, I mean, how do you motivate the teenagers and the kids and the families and to do it all as a family? For those kiddos who aren't really wanting to hang out with mom and dad, but it can be a really good way mentally to connect, right? Talk to us about that a bit.
Yeah, I would say number one, I don't use workout a whole bunch with families because no one likes to work out.
Yeah, work
So
out.
be active. So for parents, change your language. Talk about being active. We want our kids, we want us to be active and move our bodies. So thinking of creative ways to move our bodies and to get our families involved with it. It could be as simple as in the fall, we rake leaves together. We go out as a family and we go play in the leaves. For winter, it's helping to trim the tree. You're going to move your body and trim the tree. It's finding these novel things that we already do day in and day out and getting the families involved and making it a point to involve kiddos. Kiddos, we have 10 things we have to get done this weekend, but one thing has to be being active. So what are the things you want to do to be active? And involving the family as a unit, not just the parents saying we got to move our bodies.
Right, because then it's going to be a hard no.
Correct.
You're telling me to do something? I'm not doing it.
think so.
Okay, so you're saying though that family, because we're talking about mental health, because we're going to try to combine the two. So families should take time to reflect on 2021. What went well? What was good? What
Yeah.
were the positives? Walk us through that a little bit.
So the idea being that when we reflect on this year, and I hope we do this every single year, every single month, we're going to reflect on what was great. This year was full of great things. There were definitely hardships and sad things that happened, but what were some of the good things that we are proud of as a family, as a unit, and then individually? And maybe for your kiddos, it's they got an A on this test that they worked really hard on, or Dr. Hawk, son wins a championship. So being able to reflect on some of these great things that have happened over the course of the year. And I also want you all to make space for your children to talk about things that were a struggle. There were struggles this year, so we want to honor and give space for struggles as well and talk about that and make sure that kids know they have a safe space to talk with their parents and talk about the struggles as well.
Yeah, and not make it sound like everything has to be great, because
Correct.
everything wasn't,
Everything wasn't
great, and that's okay. But I think, like you just mentioned, Dr. Hawkinson's son winning his championship, I think sometimes maybe those things meant more now.
Yeah.
They may have just been like another day, another great thing that happened in our family, but when you take a minute to reflect and go, well, that actually meant a little bit more this time around.
Because it took more to get there. It took more to get
Exactly,
there this year.
exactly. What about planning for 2022? Because
Hard time saying that, huh?
Seems like we said this time last year. Let's make it the best year it can. And I always say that every year. Every year should start out like, let's make this the best year we've ever had, even if there are struggles, and we know they're going to be. But how do we actively sit down as a family and get ready for 2022?
Yeah. And I'm going to use this that I use a lot, and this is a new normal. I think we thought that COVID would be over in 21, and that would be fine, or 20, it would be over in 20. And I think if we just kind of separate, we don't know when COVID will if ever end. Let's not focus on the COVID ending. Let's focus on what we have control over. And we have control over making goals in 2022. That can be highlighting some academic pieces, some sports pieces. What things as a family do we want to accomplish this year? Is it some, I don't know, yard pieces? Is it some revising the house, or whatever it may be? But making plans individually and as a family that we can work towards. I think when we have the ability to work towards things and we accomplish them, that creates a very, what do I want to use? A sense of pride, a sense of accomplishment that some children don't have a lot of skill set in just yet. So if we can teach our children how to be successful, if we can model how to be successful, despite some roadblocks, because we're not always perfectly successful in everything that we do, But if we can model to our children how we overcome adversity, and this again could be as simple as they have a spelling test and there's one word out of those 10 words they just cannot get. How do we help them to get through that one word that they can't remember the F and after, for example? How do we help them get there? And it could be really small things that we can create into really big things of maybe your prom won't look the same again this year. How do we work to make prom the best it can be?
And well, we have something to look forward to. That feels really good. So when we're planning, looking forward to checking the list and getting those goals accomplished. What about building traditions? And not just, I think we think of traditions around the holidays and things like that, but I'm just saying daily traditions that you carry out through the entire year, new habits that we form, and kind of taking check of those and writing them down and figuring out kind of how to prioritize that.
Yeah, and I think we often think of like the holidays, as you said, but it could be every Sunday afternoon we go for a walk. It's building in these things every single day. Something as minor as having a meal together. I think most of us have gotten so busy pre-COVID that we didn't all sit down as one family unit and have meals together. So being able to sit down and have a meal where we talk about our day. I use roses and thorns. So roses are what's great about your day. Thorns, what were things that were kind of a struggle about your day? And then you can use a leaf for what you hope for tomorrow.
Roses, thorns, and leaves.
Yep.
I love that.
Yeah, so something as simple as sitting down with your family and everyone being involved in that. Not just the children, but the parents being able to say, you know, what was great about my day was I did this great thing at work, or I had a patient that had a struggle. But being able to show them that as adults, it doesn't magically change because we're an adult. We still have roses, we still have thorns, and we still have buds.
And everybody's family unit looks different. Our families look somewhat similar. We got young kiddos together, but a lot of times people's families are their neighbors and their colleagues and their friends, and it's kind of building new activities and traditions with those folks and checking in with them and calling them and asking those same questions to other folks in your life, right?
And I think we've used social media to reach out to each other during this pandemic, and so not letting that go. I think we should always hold tight to the ability to Zoom each other, the ability to make a phone call, which I don't think we do that at all. We text, we may Skype, we may Zoom, we may FaceTime, but we don't actually sit down and just call someone.
The power of hearing someone's voice that you care about on the other line, asking you how you're doing, asking about your day. Something, you had a suggestion about creating an activity jar and putting different ideas into a jar and then pull them out. And I have done this with a group of girlfriends, so it's not just your kids. So you can do this with friends and your colleagues. Just pick a piece of paper and ask, you know, gosh, if there was anyone in the world you could meet, who would it be? And just start conversations. Tell us a little bit about how we can create our own.
Love the idea of being able, if it's your family unit, if it's extended family, if it's your girlfriends or classmates or whomever they be, just for, I think for families, it could be activities. So what are activities that everyone's interested in doing? And each member of that family gets to write down some options. You put it in a jar, you pull it out, and you do the activity. It creates this kind of sense of, I don't know what we're going to do because it's going to be a surprise, and whose name or whose idea gets pulled out. Keeps everyone involved, but also there's an element of surprise, and parents have to be ready for some surprises, and so you may put some limits on what your kiddos can ask for in the activity.
Oh no, they'll just stop me in the middle of walking from one room to another and go, Mom, you have to answer this one, and they'll pull out and I'm like, oh boy, I got to answer this one. I got to really and it does make you stop and reflect for 1 minute and just have a moment with your kid to have a fun, quick, funny conversation. I think they're great. I really do love those.
And if we have winter this year and if we get snow and it's cold and we're going to be indoors, this is one creative way of doing an activity that doesn't involve leaving the house if it's cold, that you guys can have some hot cocoa and play a game of guess what, and you have to make questions and answer them out of your kids.
Leave them on your coffee table. We leave them on our coffee table or leave them on our kitchen table, and sometimes, sometimes it sits there for a few days, and sometimes someone just randomly picks something out just to get the conversation going. I love that idea. But you also emphasize that time spent as a family doesn't have to be like a big thing. Don't make the things that you do every day that seem like the norm more memorable, more of a connection. What do you mean by that?
Yeah, the idea that I think sometimes as parents we want to look for these big elaborate ways to show our love and affection to our children, which I'm not saying that's not okay. It's okay, it's just that shouldn't be the focus. I'm a big fan and proponent, and I teach parents, don't go to the store and buy things for your kids. Let your kids pick activities to do. Let them be involved in some of the decision making, and let's focus on that piece of letting them be more involved, not spending money. And so the idea, if we can spend more time with each other, and just able to reflect. I'll give an example. This morning, my daughter was doing some homework this morning, and just sitting with her for a few minutes before I left to talk about what she was planning to do with it and what she wants to do and how this is going to turn out and kind of the goals. Something as benign as her doing her homework turns into a 2-minute moment of being able to talk and connect with her and let her know that she's going to do an awesome job on her assignment. It's going to be great. So finding those little opportunities when it's just you and your kiddos or you and your spouse or you and someone you really care about to take a few moments and ask them how they're doing and what they're doing and how things are going makes a difference in our mood just because we had someone ask about us and connect with us on that level.
I'm so glad you said that because, I mean, my mornings consist of just getting up and rushing and I get into my groove and it's just get backpacks and get homework and get yourself fed. And it does. And you feel like you're doing what you're supposed to. I do at the end of the day. I walk out the door going, okay, check. And then I go, oh, but I didn't really, there was not really those moments that we could have had, you know, sometimes, but not always. So thank you for that reminder. I will have to do that. Okay, we're going to head out back to the Sports Medicine Performance Center where Alexis has been planking now. I've made her plank for a long time. I'm just trying to be brutal. I'm sorry, friend. How are you?
That was the longest minute of my life, Jess. They lied to me. They said you were coming out to me. All right, I'm here with Kelsey Engat, also known as the Punisher.
Yep.
She is talking me through planks. Every time you do that, you're making it harder. Kelsey.
I'm making it better.
Oh my gosh. Okay, she is a lifestyle fitness and corrective exercise supervisor. Can you explain the corrective part?
Corrective exercise speaks to anybody with chronic pain or injury, also disease. So basically taking an unwell body and teaching safe exercise. Yeah.
This isn't me raising for surrender. This is me ratcheting
High five.
up a notch. High five.
Love it.
Kelsey is here. She's going to start showing us some of the exercises that you, if you're watching this at home, which most of you are, can start doing today. If you want to get back in the groove, you're going to show the more heavy-duty versions. I'm going to show the modified versions. And then we have Roger over there on the machinery who's going to show you the gym versions. So why don't we start with move number 1, Kelsey? What can people start doing at home with the equipment they have or even equipment that they don't have yet?
One of the best things people can start with is just a body weight squat.
Okay.
The squats not only work your whole lower body, but also can get your heart rate up a little bit, so you get a little bit of that calorie burn going. So base version is just to stand feet hip width and up and down into a body weight squat. If you wanted to take that to a super high intensity home version, you can do a jump squat. And if you're just beginning or sitting on your couch, I'll have you demonstrate. You can go to a sit to stand. So you just want to start on your couch without using your hands on your thighs. You want to stand and then just sit, just barely tap your tush to that couch cushion and then drive out of your heels, come back up to it.
Got a question for you about form. How do you make sure your knees aren't going? What's supposed to be happening with my knees while I'm doing this? And I'm going to put the mic down while I try it.
Yes. So the biggest thing in the squat is that you want to make sure that your knee never comes out in front of your toe. So actually the couch helps you do that because how I coach my clients is to make sure that you sit back in your hips, drive your hips back because that pulls your knees into the correct position. So the couch, when you're just getting started, actually gives you that goal of making sure you sit back in your hips and that keeps your knees at a safe position so that we're not hurting the knee joint, but we're working the thighs.
You don't need any equipment, you just need a chair or a couch.
Absolutely.
What's next?
Okay, next we're going to go to upper body. So again, just a push-up. So there's a lot of different versions of a push-up. At home, probably the hardest version is just to go ahead and do a full body weight push-up, making sure to get through your full range of motion.
Okay.
The first modification to that would be to go onto your knees. So the biggest thing here is you want to still make sure that your hips are tucked. A lot of people when they're on their knees will leave their butt in the air for your push-up.
Right.
You want a nice straight body like you're doing a plank, just like you were doing before. And coming up and down to that push-up. And again, for anybody that's just getting started, even if that is too hard, then what you want to do is take it to an elevated surface. So like the edge of your couch or the arm of your couch. And coming.
I hear laughter. Is Jess laughing at me?
So then you can also use the edge of your couch. So you're getting a full workout just right here at your couch. It's not just good for sitting.
But it's pretty good for sitting.
You can sit after you get your endorphins.
What about Roger? What are his versions of those from the gym?
So gym version obviously is going to be, he's going to do a back squat here with just a little bit of weight on it because, you know, he can. So things here, same thing, form. That's one thing that we always focus on no matter whether you're an athlete doing a back squat or getting started with me doing body weight versions. But
now, Kelsey, are these things that someone here will talk people through, or what if this is your first time using the weights like Roger is using? I mean, they're not just going to jump in and try to do that.
Oh, absolutely not.
Right.
Everything here is done in a progressional way. So we start you where you need to start. So even with athletes, we are going to start at your fitness level and then progress from there. And form is the biggest thing that we focus on in all of our fitness because it is key to getting the best results and staying safe.
And now you have one more thing to show us that we can do at home. So we've done the squats, we've had the modified push-ups. What next?
So now we're going to talk about cardio exercise.
Okay.
So those are more strength training exercises. In a gym, obviously you have traditional cardio machines that you can use. We like to have people do interval training. So with an interval training situation, you want to go to a higher intensity, get your heart rate spiked up there, and then drop it to a lower intensity to recover. And by doing that high-low intensity, you get kind of more bang for your buck, and you kind of lose the boring aspect of just chugging away for 30 minutes on a cardio machine. At home, you can do something very simple to get the same effect. So we're going to do a mountain climber first, coming down. Doing a mountain climber, usually at home, I will just give you a number. So let's say 20 mountain climbers. Moving those legs pretty quick.
You're going a lot faster than me.
And then to interval that, we'll stand up and just do a standing march. So still moving, but not moving as intensely. So we can bring the heart rate down and then do it again.
I gotta say, I'm actually, I don't know if I should be embarrassed or not, but I'm out of breath from walking, doing those just modified versions, which tells me I need to do exactly what you are teaching us today. I do have a question. I want both of your take on it. Roger, since I have the mic, I want to I'll come have you be in between us. Come on over here, Kelsey. I do have a question about wearing masks. Where are you hiding?
Me in the middle?
This is kind of fun. Wearing masks when you're exercising. I'm out of breath, and I've just been doing this for a few minutes. It is COVID. People are nervous. I'll walk past gyms and see people huffing and puffing with their masks on. Sometimes they're not wearing masks. So can you give us your professional expertise and your professional opinion? Is it okay to wear a mask when you're doing cardio and you're working out like this?
One of the things your body can't go very long without is oxygen. So as long as you can breathe under control, you're safe. Now, as soon as you start to get into a point where you're breathing heavily, it's always best to get into slow down your tempo, and catch your breath. It's also recommended that to bring a spare mask, because as soon as this thing gets wet, it gets even harder to get oxygen through. So if you're a high sweater, your mask starts to get saturated, switch it out with a dry mask and keep it rolling.
Kelsey, what about you? What do you tell your clients when it comes to masks?
Pretty much the same thing. It is not dangerous to wear a mask during exercise. You will get winded more quickly because you are breathing through the mask. But just like Roger said, and that's why we talked about the interval training, the key is when you start to feel like you are no longer breathing under control, you back your intensity down, you take some deep breaths, you bring it back to a normal heart rate or to a controlled heart rate, and then you can push again. So it's absolutely safe to wear a mask, but just maybe making small modified changes so that it feels more comfortable when you're wearing the mask.
To button things up, I want to make sure you guys know where we are. We're at the Sports Medicine and Performance Center at 125th and Antioch. One of the cool things that I notice when I walk in here is you have all these windows like at a firehouse, where the windows will just slide up so you can open up these walls when the weather gets nice and really get some fresh air and some cross ventilation going here. And that is so great at a time when people are more mindful that they're exercising, and then they're in a spot where there's some fresh air. And you have some really great deals for people who want to join just regular people sitting at home. There's a 25% off deal that you're offering.
Absolutely. It's our winter special. If you join with any package or membership, we'll take 25% off your first month. And it's a great way to get started. Honestly, we're conscious of your budget, so we want to give you a little deal to get you kick-started for the New Year's and those New Year's resolutions.
And you welcome beginners, you welcome intermediate, you welcome experienced people who work out all different levels.
As long as you have a heartbeat, as long as you have a heartbeat, we'll welcome you in.
Thank you so much, Roger. Thank you, Kelsey. This was a great time. I'm going to toss it back to you in the studio. And if the audience, if there are any viewer questions, I'm going to keep these guys here to ask them questions from our audience as well.
Okay, I was just going to have you do that because I think we're going to jump into some
Okay.
community questions, Alexis.
We do have a question.
And
Okay.
I've got a good one from Joellen. She says it's difficult for many people to get out due to physical issues. But can you ask Kelsey and Roger, what can seniors do to motivate themselves at home? And do they have any exercises for balance?
Joellen has a great question, one of our viewers. She wants to know what seniors can do who aren't as mobile and can't get out of the house often. And if you have any specific activities or exercises Joellen would like you to demonstrate for balance. Do either of you have those? Kelsey. Okay.
So something that I tell my clients all the time that want to work on balance is to challenge yourself in daily activities. So when you're in the kitchen cooking, just stand on one leg and do what you're doing, or filling your glass of water. When you are brushing your teeth, take a second, stand on one leg, brush your teeth. I like to do this because usually those situations you are by your sink or by your counter, so you can use that for a little quick balance check if you're not so good. The other thing that you can do is what I call an 80-20 stance, which is to put 80% of your weight in your balance leg and then just keep that toe down so that while I'm doing my stuff at home, I'm still working on my 80% leg, but giving myself that little touch of balance so that I don't actually feel really wobbly and off center. So the best way is just to start using that balance in daily activities and challenging yourself to do that on a regular basis.
Absolutely. So when Kelsey was lifting one leg, one thing that most people start to lose is connection from the mind to the other stabilizer muscles. So as she lifts one leg up, now she's activating her glute, her quad, her core. So lifting up one leg, all of a sudden now you're activating more muscles your mind has to actually focus on, and that's actually going to help you improve your balance.
That's a great thing to try. You guys should try this after the broadcast. You really do feel it all the way up your core when you just stand on one leg like a stork.
Yes.
Great question from Joellen.
Yes, and Sean wants to know, he does a lot of biking, so a lot of cardio. How important is strength training? And how many days a week should he do that?
Viewer Sean does a lot of biking, cardio. He wants to know how important it is for strength training and how many days a week he should do strength training if he enjoys biking.
I recommend at least twice a week, preferably up to 5. But if he's always biking, I would say 5 days of vigorous exercise. So 2 days of lifting, coupled with 3 to 4 days of biking, maybe 1 day of both will be a great routine. Your body still needs time to recover, so I still recommend taking at least 1 day, preferably 2 days off, to recover and allow your muscles to rebuild.
Kelsey, anything to add to that?
The only thing that I tell my runners and bikers and my cardio lovers that like to do endurance cardio exercise is to remind them that the strength training is important, because what we want to do is counterbalance the neuromuscular chain that you're always in. So when you're biking, you're doing the same movements, and so the same muscles are getting challenged. So in your strength training program, by counterbalancing those, you keep your body well-rounded and strong, and that helps to avoid injury, and it actually will help you be better at your sport.
Great questions. Do you see
All
a lot
right.
of injuries? Oh, I have a question I was actually curious about that someone had asked me before, knowing that we were doing this segment. Are you seeing different kinds of injuries from people who are jumping right into a fitness program when they might not have done it for 18 months?
So in my room with sports athletes, usually we do a good job of slowly easing them into it. But more than anything, what we'll see is they will think they're at a level in which where they stopped, where they're not. All right, so we have to gradually progress them, and more of it's a mental mind game of, hey, you're not where you were, but you're going to be there twice as fast as you were when it first took you there because of muscle memory. So your body is going to remember that work you were able to do, you're going to be able to get back there. So as long as those individuals are smart and don't try to jump right back in where they stopped, they'll be fine.
Yes, in the corrective exercise and the chronic pain realm, I certainly have seen more people coming in you know, as the weather, especially when the weather got nice and everybody's like, okay, this is my chance again, I'm going to get back to it. And that's just a common mistake people make, is trying to go too hard too fast. And so instead of being like, I've been sitting on my couch for a year and maybe I should progressively get back to running, they're like, today's a good day, I'm going to go run 5 miles. And then, you know, usually it is not severe injury, but just, you know, the shin splint or the foot pain that you get. And so it is very important to start back progressively and to start back with a plan instead of just trying to go gung-ho from nothing to everything.
Great advice. Back to you in the studio, Jess. Do you have any more questions for us? You going to come out and join me?
Oh, gosh, no. Absolutely not.
Gosh, no.
Don't be scared, Jess.
I'll handle the
I've
heavy
had the
lifting today.
I've had the Kelsey treatment before.
She makes it look easy, and then suddenly you're sweating and you feel like
Yeah.
you're going to pass out.
I've been
Kelsey
there.
treatment.
I'll stay here. Okay, so I do have a question from Isaac about how safe it is, Dr. Hawkinson, now that people want to go inside, maybe go to the malls and things like that and stay inside and do their activities. If they wear a mask, don't wear a mask, how safe is an indoor activity like going to a big indoor space to walk and get your physical exercise?
Yeah, I mean, I would say something like a mall that you had said, you know, is a pretty big area. You're going to be walking and moving, so you're not going to be in one set small area with a lot of people. If that's how you are getting your exercise, we know that's a popular activity. But wearing a mask is going to be vitally important. And if you want to wear some eye protection as well, that will also be one more measure to help reduce your risk of getting exposed to SARS-CoV-2.
So Janet wants to know, she says, my granddaughter is coming over to spend a few days with us. She is socially active and does not wear a mask, but she is fully vaccinated with her booster. How long should the granddaughter quarantine to keep them safe? Or should we be doing those quick tests when we get together with family over the holidays?
Yeah, and I think it's a matter of layers, and all of these layers, whether it's eye protection if you're walking in a mall, testing before quarantining, or staying out of those social situations for 10 days or 2 weeks prior, those are all layers that are going to help provide more, less exposure to the infection and provide you and your family members with more confidence that nobody coming to meet and gather will have an active infection going on. Again, there are still so many questions about Omicron that we don't have answers to about, you know, vaccine-induced immunity, although a lot of people are still saying there will be, the vaccine will continue to be effective. But I think adding any of those things, if you can keep from going out and being in that social life or being in those social situations, especially without a mask, for 10 days or 14 days prior to meeting and gathering, if you want to take one of those take-home antigen tests the day before, 2 days before, and the day before, or also go get a PCR test, all of those things are going to add layers for your confidence in understanding and knowing that when you go to meet these people and gather with them, it can be as safe as possible.
And Dr. Hawkinson, a couple questions about the numbers, and if you know them, great. If not, we can get these and get them on tomorrow. But how many in the ICU, Lindsay wants to know, how many in the ICU are unvaccinated, and how many of the COVID cases are the new variant? And do we know that yet?
You know, we don't know how many are the new variant. That will be really dictated when we get the information from the state, because we know that the state is doing all of the sequencing. So it's really at the sequencing level, which we don't have really access to that here at the hospital. And how many are unvaccinated? In the ICU, 11 of the 12 are unvaccinated. And again, in total of the 35 active infections, only 5 total are vaccinated. So that includes that one in the ICU that is fully vaccinated.
And do you know what the active infection number is right now compared to this time last year? About, and if, again, we can get those specific numbers tomorrow.
Get those, yeah.
Katie wants to know, after a plane trip, when do you get a home test? Should you get a home test?
Yeah, I think after traveling, if you're looking at this, if you think you have exposure, I think you can kind of go back to what the recommendations are for if you've had a known exposure, and really that recommendation is about 5 to 7 days after that potential exposure, that you can go ahead and get a home test. If you want to get it earlier, after 3 days, I think that's okay too. But if you prolong that testing time, you have more chance of really getting the true accurate result, rather than, say, missing it before that time, getting a false negative, if you will. So if you can prolong that out to 5 or 7 days, I think you'll probably be better off.
But that's if you have some sort of symptom or
Yeah.
risk factor. You're not saying that just because you fly on an airplane you should necessarily get one, unless maybe you're going to be going to someone's house who's at risk.
No, yeah, this was just in response to that specific question. Yeah.
Okay, so Isaac wants to know, he just received a package of KN95 masks. How much safer will he be to attend an indoor event with that compared to a cloth mask? What's the KN95?
Yeah, I mean, I think we know that, so certainly in the hospital we have an N95. There is a little bit of difference there in the KN95, those masks that you can buy, say, at the hardware store or something like that. You still will have a little bit better filtering and a little bit better protection as far as exposure, but also if you have it, expressing it out into the environment using one of those KN95s really is still, the recommendation is still, any 2 to 3 layer cloth mask or a surgical mask or an N95. Remember here, the fit is what is important, but certainly you will get a little bit more filter and protection with that KN95 as opposed to a surgical mask or the cloth mask.
All right, so we're going to get to final thoughts here from all of the folks on our panel today. But Dr. Johnson, before we get to your final thoughts, I do want to just make mention, you said that your young 4-year-old who is unable, of course, to get vaccinated has just been quarantined. Their school had another outbreak. Tell us a little bit about what that's been like and how you were alerted and what you all are doing to stay safe.
Yeah. So I think I'm in the same boat as many parents of kids under the age of 5 that go to a preschool and they're getting exposed to COVID, because COVID is here. And so for my youngest, she's been quarantined. This is her 3rd quarantine in the last probably 11 weeks because the virus is quite active and it's being spread. And so what we have concerns about now, I think not just for my 4-year-old, but for all my children and for many parents, is that we've had Thanksgiving. And so I can say for my school-age children, the school nurse says she is very concerned with holiday gatherings and the impact of that on COVID numbers at the elementary, middle school level. And so as a parent of a kiddo who's being quarantined, this is not the first time. And I think for a lot of parents out there, you guys have probably become pros in quarantining your kids. And so we have the routine of she stays home, she wears a mask if we have to go anywhere, she'll get tested, and we will just kind of wait until the next exposure, unfortunately.
Until you get the clear.
Yeah.
Dr. Hawkinson, just a quick question for you on that note. So do you think we're starting to see the results of these family gatherings? Do you think these are just isolated cases, or do you think we're actually going to start to see that uptick because you had a mixture of kids who are not vaccinated and in schools around other people? What are your thoughts?
I think it's a combination of all of that. We knew that even prior to Thanksgiving, there was an increase in the number of cases as well. So it is a combination of a lot of these behaviors. Yeah.
All right. Final thoughts. What do you want us to know as we head out about just kind of keeping our minds right, getting ready to wrap up this year, heading into the next year? What do you want us to know?
I want you guys to know to make sure you're connected to people. Make sure the people that you care about, you are talking to, that you are doing things to take care of your body, both physically. We all know that physical activity does do a great thing for our mind, but to do things to take care of your mind, to take care of yourself and those that you care about. We know that having connections is a protective factor for mood disorders. And so if you have some struggle and you have a connection in your community, you've got some people that can say, hey, you're not looking right. Is everything okay? And so making sure that if you're having a rough moment, you have someone to talk to. And that if you see someone having a rough moment, that you say, hey, are you okay? And so having these family activities as a parent also keeps you keyed into your kids, because you get to see that we've been hanging out every single day for at least 20 minutes. And this is week 4 of this, and they're not looking to like themselves. And so having that connection lets us know that someone's may need some more support.
And I can't let you go without telling people about Marillac, what services you provide, and how important it is that parents know that you are there for their kiddos.
Yeah, so Marillac is our inpatient psychiatric facility serving kids ages 4 to 17 years and 364 days old. We're helping kiddos that are struggling with severe mood disorders, so depression, anxiety, struggling with suicidal thoughts or plans or actions. And so our job is to stabilize children to get them safe and back in their community so they can really work hard with outpatient therapists and psychiatrists to stay safe. And so we provide inpatient care 24/7. And if you ever need help or concerns, if your child's in acute danger, please call 911 and they will get them screened to our hospital and get them over to us. We can also do a phone call, and you can schedule an appointment as well to get your kiddo assessed for inpatient treatment. So
Don't delay the phone calls. You can't help if we don't make the phone calls, right?
Correct. And if you're truly concerned your child is not safe, they're going to hurt themselves or someone else, call 911. They will get them to us once they clear them.
Thank you for that message. Always good to have you. Come back soon, okay?
All right. Thanks.
Hey, Alexis. Okay, I'm going to get some final thoughts from Kelsey and Roger.
Let's start with Kelsey. Kelsey, what are your final thoughts as we enter into a new year?
Mostly, I would just really encourage people to get started. Your health and your fitness is so important for so many reasons, mental health, physical health, and it can be simply just doing things in your home. Pick a commercial break and do some stretches, do some exercises, just get started. So whether you are doing couch exercises at home or you want to come consult with a professional to really get a plan started that's just for you, take it seriously this year. Do something good for yourself, for your mind, for your body, and enjoy it.
Roger, what are your final thoughts?
I like to say that it's never too late to make the rest of your life the best of your life. So like Kelsey said, get started, decide to make a change. Whatever you have, go ahead and plan on it. And right now, like I said, we have a special going on. If you want to be with professionals that are going to safely help you get to those goals, come see us and we'll take great care of you.
Never too late to make the rest of your life the best of your life. I love that.
How do you follow that? Dr. Hawkinson,
don't.
I don't know. What are your
Do I
beautiful
drop the
words of
mic?
wisdom?
Yeah, I mean, I think we need, every individual needs health for themselves, for their interpersonal relationships. It's important to be healthy in mind, body, spirit. You know, go find a place of worship, examine your faith. Physically, nutrition is so important, sleep is so important, activity is so important. Medically, also in that physical sense, you know, vaccines are so vitally important. We hear stories every day now about the pandemic and how it has reduced the overall vaccine preventable disease outreach programs. And this has caused more of those vaccine preventable diseases, such as measles and chickenpox, to run rampant through certain populations. So it's very important. If you have children, if you need to get caught up on your vaccines, please go get your vaccines, especially the COVID-19 vaccines. Please go at least get a first dose if you haven't yet. Please remember to get your influenza vaccine. You know, last year from September 20 to March of 2021, in that 6 months, we had about 1,800 total cases of influenza diagnosed in clinical and public health labs in the United States. But right now, in the last 7 weeks, from October 3rd until about November 27th, we've had over 3,500 cases of influenza diagnosed in those clinical and public health labs. So it's very important. We are seeing increase in influenza rates. Please go get your influenza vaccine now. You still have time to get protection.
All right, Dr. Hawkinson, thanks. Glad you're back. All right, and thank you all for being with us today. And don't forget, you can catch our show anytime on YouTube and on Facebook. Coming up tomorrow, as Dr. Hawkinson just mentioned, COVID and flu cases are now on the rise. So more and more people are contracting some sort of virus, and that is not good as we get ready to spend more and more time with our family for the rest of this holiday season. So tomorrow we have the chief medical officers from several metro hospitals joining us. Dr. Stites will be here. They're going to all tell us what they think about this upcoming surge possibly, and then how we can protect ourselves and our families during this time. So please have a wonderful day. Make it a great Monday, and we'll see you back here at 8 a.m.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.